Welcome to Quality Time, a Houston Methodist leading medicine podcast. I'm your host, Dr. Schaal, a clinician scientist and a retina specialist, and I serve as the Chief Physician Executive of Houston Methodist, located in the world-renowned Texas Medical Center. I passionately believe that quality is the heart of healthcare, and a commitment to quality is essential for every healthcare system. Join us each month as we discuss the latest advancement in quality in healthcare with clinicians, researchers, physicians, industry experts, and thought leaders who are as passionate as I am. And today, I'm pleased to welcome two very special guests to the podcast to talk about a subject that is foundational to Houston Methodist, spiritual care. Reverend Dr. Charles Millikan is the Vice President for Spiritual Care and Values Integration for Houston Methodist. He holds the Dr. Ronny W. and Ruth Barner Centennial Chair in Spiritual Care. He is a clinical professor for the Medical Ethics and Health Policy Department at Baylor College of Medicine and an adjunct professor for the Perkins School of Theology at SMU. Reverend Stacy Auld is the System Director of Spiritual Care and Values Integration for Houston Methodist, and she works very closely with Dr. Charles Millikan. Welcome to you both.
Thank you for having us.
So tell us a little bit about yourself. Maybe we're going to start with Reverend Auld. Tell us a little bit about yourself.
Well, I am an ordained United Methodist minister, but I haven't always been in ministry. I was a business major at Texas A&M for undergrad and went into the jewelry industry and was a jewelry buyer for about 8 years and then felt called into full-time ministry. So I went to Duke University and got my Master's of Divinity out there in 2007. And then I was in the local church for just a couple of years and then found my way into hospital ministry in 2009. So I've been here for the last 15 years, serving in various roles in chaplaincy, and currently serve as the system director to support all of our hospitals across the system and their chaplaincy teams.
Wonderful. Dr. Millikan?
Well, I was going to be a doctor. And interestingly enough, God called me to the ministry. And so I became a pastor of churches and actually worked as a district superintendent and pastor of large churches. And then 20 years ago, had the opportunity to come back to Houston Methodist as another form of a doctorate, and that is a doctorate of theology. So it's been great to be here and to be a part of Houston Methodist. Just wonderful.
So tell us a little bit, what is spiritual care? How do we practice it here at Houston Methodist? What is the basis of it?
Stacy, why don't you speak of that? I think you have a wonderful definition of it.
Spirituality is the way a person seeks and experiences ultimate meaning, purpose, and transcendence. It's where they find significance and sacredness, and everyone has spirituality. It can encompass religion, being a part of a religious institution or a community, but it goes beyond that. It's the meaning, it's the purpose that people can find through their own vocation, they can find through family, they can find through nature. And so attending to someone's spirituality in a hospital setting, that's what spiritual care is.
Mm-hmm.
And we understand that medicine is holistic, and that is not only physical, but spiritual.
So taking care of the non-physical part, the emotional part, which we know right now in medicine that is so important to healing. How do we help here at Houston Methodist patients heal with spiritual care? What do we do? Give us some examples.
Well, first of all, we want to be fully present for every person that's here. We want every person to feel important. Not only that they have the best medical care in the world, but that they're understood as an individual, that we understand their culture. We expect and, of course, find their diversity to be very important of who we are. So when we have a patient in our hospital who are, of course, the center of everything that we do, it's important that we have unparalleled excellence in terms of not only the academic side, but also the spiritual and emotional side. And if we have that, then that increases not only the effectiveness of our medical clinicians, but it also affects the care the patient wants to have toward their own resilience in being able to get through whatever trauma or whatever case they may be involved in that's going to be leading to better health.
So do the patient ask for it, or how do we, our listeners probably don't know. So tell us a little bit of how is that done practically?
Right. So we have chaplains, board certified chaplains embedded in all of our clinical units throughout all of our hospitals at Houston Methodist. And to be a board certified chaplain, I think this is important to say because people don't understand this all the time. You have to have your master's level degree. You have to have done 4 units of that clinical pastoral education, which was the residency program I did here at Houston Methodist when I first came in 2009, which is 1,600 hours of a combination of classroom work and clinical work. And then you have to demonstrate 29 different competencies that our profession has laid out there for being a board certified chaplain.
For example?
For example, there's competencies that are categorized in personal identity. So kind of knowing who you are, because we all are formed in our own tradition, our own spiritual tradition or faith tradition, and understanding how that is informing our care. But then also knowing that we are not ever projecting our own personal faith onto somebody else. So that skill of learning how to connect with people, being informed by our own tradition, but meeting people where they are. So there's a lot of personal stuff that we have to work through in a residency type setting where we recognize our triggers. If we're listening to a patient and something triggers us emotionally, we come back to a peer setting or a supervisor setting and kind of process through, like, what was it that patient said? Or what was it that person maybe reminded me of my mother or my grandmother? And why did it make me respond like that? Because I stopped listening when I got triggered, right? So let me work through that and maybe be a better listener the next time I encounter that kind of situation. And so there's a lot of personal work that's done for a professional chaplain. Then there's the practical skills, understanding theory around grief, human development, faith development, all of those things. Then there's even a category about organizational leadership. I mean, because we're all situated within organizations and institutions like Houston Methodist. And if we don't understand how a chaplain is to collaborate and to work with and to understand healthcare on a bigger scale or your organization and the values of the organization, then we're not going to be as effective as we can. So those are some of the competencies that we have to have and demonstrate to be a board certified chaplain. And we all are, we will only hire board certified chaplains here. And so it's important to us to have somebody at that level in their profession to be able to serve. So back to your question, our board certified chaplains are embedded into all of our clinical spaces. And it's a combination of responding to referrals.
In the hospitals and in the clinics, correct?
So right now we're primarily inpatient. We have one chaplain that we have placed in the Neal Cancer Center in the outpatient clinic. But that, I will tell you, that's the future. That's where a lot of healthcare institutions across the country are moving, is to move chaplaincy, not to take away inpatient chaplaincy, but the inpatient at those crisis moments, but then also the journeying with people in the clinic settings that are dealing with a cancer diagnosis or congestive heart failure that may rarely become inpatient, but certainly have a medical story that having that kind of support. So that's the future, but we only have one person right now in an outpatient setting. But so the inpatient is our kind of bread and butter where we mostly are right now. And it's a combination of referrals. The patient themselves asks for us. The nursing staff or the physicians assess something with the patient and then maybe make a referral to us. And then we also, because we are a faith-based hospital, we also have a commitment to let patients know that our service is here and it's free to them and it exists. And so in the in-between times when we're not responding to a death or a code or a crisis, we're making rounds, knocking on doors, introducing ourselves, letting people know that we're here to support them.
And the secret is they're board certified chaplains. I know when I first came 20 years ago, we had a CEO at one of our network hospitals that said, "Hey, I need a chaplain. Can you find me a preacher?" I said, well and as good as they may be, that's not what we need. We need a chaplain. That is a chaplain that's board certified. So just like we have doctors that are board certified, isn't it great that you can be in a hospital where you have board certified chaplains? And saying a word about Stacy, she serves on the national board for the Association of Professional Chaplains, and she's in charge as the committee chair over the certification of chaplains all across the United States.
So, Dr. Millikan, you saw this evolve, right? The spiritual care and how it really collaborates with different areas of cares, diseases, departments that we have here in the hospital and in our community hospital. Tell us a little bit about the evolution of spiritual care, and then where is it heading?
Well, it's an exciting story to be at Houston Methodist. When I stopped to think, when I came, we had 8 chaplains downstairs, 1 director and 1 chaplain everywhere else, a total of 12. And now we have over 100 chaplains inside our system with 8 directors, a system director. Now we're working, and of course it's collaboration. It's working across the different disciplines of what we have here at the hospital. Spiritual care is always at its best when it works with others. And that's what we do constantly, whether it's on the floors, whether it's with our different departments. And so we work across the board, whether it be HR, finance, but also with the Houston Methodist Foundation. Since we're a non-revenue producing department, as you may well know, how do we bring a value added to medical care? And so we've had wonderful, grateful patients and foundations that have stepped forward that's enabled us to create new positions that once we have put them in place and found ways to metrically show how they present themselves to help in medical care, we're able to write that into our corporate budget. And so it's kind of exciting to see all the wonderful things that have happened in philanthropy through Houston Methodist.
So tell me a little bit, I am really thinking now, as the CEO of our physician organization, about the wellness not only of our patients and the spirit not only of our patients, but also of our providers. What are you guys doing in that realm? How do you support the caregivers?
Good question. Stacy, why don't you speak to that? I know you've done a lot of work on that.
In the last 5 years, we have developed 3 new positions, which came from philanthropy, which is what Charles was speaking about. We have a chaplain that is dedicated to the physician organization that is there to care for the providers, the all of our employees that work in our clinics. So 100% employee facing. They are not there to support any of the patients in the clinics.
They're dedicated to
the providers. And then we have a chaplain that is dedicated to all of our corporate employees. So all of these employees in IT and HR and marketing and finance that, are not in a clinical space, we have a chaplain dedicated to supporting those employees. And then the most recent hire, a little over a year ago, was a chaplain dedicated to our research institute. And so he supports all of the people who work in our labs and who work in all of the academic institutes, supports all the learners that come into Houston Methodist while they're here. And so that is something that has put Houston Methodist on the map in some ways, that we are a healthcare setting that is not only having chaplains support our patients, but are dedicated to our employees. Now, inpatient healthcare professional chaplains, we've always done both. We've always supported the patients, and then the nurses and all of the providers that are surrounding the patients in those clinical spaces. Staff care happens for those employees too. I would say about 30% of a chaplain's time in their day as an inpatient chaplain is spent supporting staff. Mm-hmm. Because we feel like if nurses, frontline workers, clinicians are feeling cared for, they're feeling heard, they're feeling supported in whatever way, that they're in turn better equipped to take care of our patients, right? So that's always been a part of a healthcare chaplain, is supporting employees. But what's new and what's been new for us that we're watching is this dedicated employee chaplain that's supporting employees only.
Yeah. I really think that, caring and healing actually developed from churches and temples and holy places. That's where it originated. And, when we didn't have a lot of knowledge of medicine, actually spiritual care was very prominent. But as we really turn into the 21st century with a lot of standardization of processes, technology, and other things, spiritual care may have been forgotten. Certainly not here, but in other places. So I started Houston Methodist about 2 years ago. And something that I can share with you both is that I found it as a really almost a holy place. I remember interviewing with Dr. Millikan when I was interviewing for my job. And I'm like, oh my God, this is amazing that we have it here. And so tell us a little bit how we bring back really the spiritual care as part of standard care, as part of something that we all need and we all are open to. Because I am sure that there are, people from different backgrounds, different cultures that say, who is this person and why are they coming to me here? And how does this contribute to my care?
Well, we see every person as a person of sacred worth, period. And when you think of a hospital, you think of hospitality. I mean, that's a part of who we are. And it did begin as we know, medical care in the caring communities of temples and churches early on in our centuries of history. But the truth of it is that we're at our best when we're always seeing the spirituality of every person, wherever they are. And we have a lot of people who have no faith commitment. They're called nuns, N-O-N-Es, but they also are persons of spiritual worth. And it's important to understand that every person is a person of sacred worth, and we value that. And not only the patient, but the persons who serve them.
So the patients and families, they are open.
They're
feel
open.
that they're open to this approach.
Yes.
And what kind of responses do you get from patients and families? Just an example.
Well, we know that when you're a patient in the hospital, there's a lot of things that come to your mind in terms of your own mortality. You're not here for rest and relaxation. This is not Club Med. You're here for a reason. There's something that needs to be removed, something that needs to be replaced, or something that has to be taken care of and solved. So it's not a matter of just treating the disease. It's a matter of treating the person who has the disease. And when you have that perspective, then all of a sudden medicine carries new weight, and spiritual care then becomes even more prominent.
And our physicians and caregivers, they are open to that. They are, what are responses that you're
Well,
getting?
we hope they are. Every person comes from a different spot, a different place. And there's a lot of history involved in every person that comes into our halls. But we do know that if you are able to be respectful for them, that you spend most of your time listening and not talking and asking the right questions and getting them to open up and talk about what's going on in their hearts, minds, and souls, it's amazing what can happen toward healing. Because healing is not just a scientific experience, it also is an emotional and spiritual experience.
For the patient and their family.
Absolutely.
And for the physicians maybe as well. I'm a surgeon and I know how involved I am in the process and how invested I am in the success. So that's important also for the caregivers. Want to jump a little and talk about the intentionality and the pause that we have here. I invited you both to several of my events, to start the day with a prayer. Tell us what it is about, and let's talk a little bit about the importance of it. Stacy, you've been doing such a great job in starting our events with a prayer. Tell us a little bit about that.
Well, one, I've appreciated the invitation because I think there are so many institutions and hospitals across the country that wouldn't invite somebody to start their meetings in that way or their retreats. And so it's truly an honor to get to do that. But I do think that when I think about those prayers and as I'm writing them and as I'm thinking about the people in the room that are going to be listening, I think about just starting from a place of gratitude. that people to be grateful for the day, to be grateful for the gifts that we've all been given that are all so unique and so rightly positioned for what is ahead of us. So we all have everything within us that we need to be to contribute to the needs and to support the needs that are in front of us. And so those prayers for me are about proper gratitude, giving gratitude to a higher being, but also gratitude for the people in the space and making people feel loved and appreciated and that they belong. I think those are the basic things that people need to hear over and over again, that you are of worth, you are of value, that you belong, you have something within you that is so uniquely you, that you're here for a particular time and place and reason, and it's to meet some of the greatest needs that are in the world right now. So I think that's a really neat way to start a day, and I'm thankful that you give me the opportunity. And in other spaces across the hospital system, we have prayer huddles that are happening all over our hospital on any given day. Clinical leaders from our inpatient clinical spaces at their shift change at 6:45 in the morning. A chaplain is likely showing up at that shift change to give thanks for the night shift that has just been there, to maybe hear some of the things that have been stressful for them, to bless them into their drive home, and then to welcome the new staff that are coming on for the day and to give thanks for their arrival and for them to be there. And I just think that
is
that
wonderful.
sets a tone.
Yeah, that's wonderful. And it's a post that is so important. And Dr. Millikan, I kind of listened to you over the past 2 years when I'm, here. And I know that you actually look at the agenda for the day. So tell us a little bit more.
If you're going to have a reflection that's going to be impactful, it needs to be related and coordinated with the person who has the agenda for the day. So what's being discussed? What's going to be on the agenda that needs to be dealt with? What needs to be talked about? And to be able to take a spiritual presence, or at least roll that into the prayer or lead that into the reflection, it has a tremendous impact on being able to set up the agenda for the entire time of the meeting. So part of our job is not just to pray, but to pray well, and to pray with a sense of intentionality, understanding what needs to be done. What are the objectives? What are the goals? Where are we going? How does it fit? And to be able to see how it integrates. If we can do that, then it shows how spiritual care is part of a team.
And to remind us of our values. I mean, we are a strong values-based, values-driven hospital institution system. And so I always think of part of our role too in spiritual care and values integration is to remind us of our values.
Yeah, we were talking about values in a second, but I want to take this opportunity to thank you both, because I know it helps me focus. I listen to you both when you start the day with a prayer, and I'm always very impressed. And also I feel motivated and inspired, to carry on whatever meeting we have, whatever retreat we have, anything that helps us focus and be together towards the results of that day. I think that's actually something that we as an organization probably should spread more. And hopefully our listeners all over the United States and the world are listening, and maybe they can adopt this, because I think it really helps the team focus, and also it makes you feel, you're doing something that is much greater than this room, than this hospital. You're really propagating a better world. I think it's very, very meaningful. So I'd like to thank you both for that.
Thank you. We have a very large table. It's very important that everyone has a chair at the table.
Absolutely.
And it's important to understand that we live in a world where that diversity needs to be respected.
Absolutely. Let's talk a little bit about values. Stacy mentioned values. Talk a little bit about our eye care values and how these are actually translated into spiritual care. The obvious one is compassion, right?
Obvious.
Well, our eye care values, integrity, compassion, accountability, respect, and excellence it really came out of the Department of Spiritual Care and the leadership at the time in the late 90s, when the executives here at Houston Methodist were reevaluating our mission, our vision, our values. And through some surveying of the employees at the time, of them being able to name what they saw as values in the employees at the time, came up with these five words. And I think that was at the time too, where we renamed our mission statement. And one of the phrases in our mission statement is that we seek to provide a spiritual environment of caring. And for us to be able to live into that mission, we have to have concrete ways to help our employees understand, like, how do you support an environment like this? And it's to demonstrate integrity, to demonstrate compassion, accountability, respect, and excellence. So they're words that you don't have to have any sort of religious kind of attachment to any of those. As a religious person can have their own understanding of how those are in alignment with their faith or their spirituality, but it doesn't need to be. They're very accessible. And so we are constantly also trying to help our employees remember that this is who we are, and affirm when we see people demonstrating those values and celebrate people. And so when you have that culture of celebrating the demonstration of those values, it just continues to grow and grow and grow.
I know when I first came to Houston Methodist over 20 years ago, someone came in and said, "What else are we going to do? I care. I mean, what else is in your plan?" I said, "My plan? No, it's our plan." And so what we started to do is to give it away. We gave it to HR. We gave it to OD, operational development. We gave to it ethics. And we began to see how it could be expanded. So as it is in philanthropy, you always get to keep what you give away. Mm-hmm. If you keep it, you'll lose it. So what spiritual care has done, although we do own it, we have given it away. And now it's a part of what Dr. Boom calls unparalleled quality service, innovation, growth. I mean, it's all part of spiritual care.
Yeah, so I do think that spiritual care is part of quality of care that we provide here at Houston Methodist. And this is a quality podcast, and that's why I invited you both, because I do believe that the spiritual environment that we provide, and Stacy talked about really propagating these values, this helps us give better care, and this helps people feel that they're in good hands. One thing that I'm wondering about is really trust in this day and age. We know that trust is eroding in institutions in general, and even in healthcare. You know, the trust in organizations and trust in healthcare, maybe healthcare providers, is eroding. How can spiritual care, how can propagating of these values help build that trust or recover that trust?
Well, it's important for us to know that we're a part of a larger team, that we're not separate. And one of the things that we're excited about right now is that we now have a chaplain in research. And what we're looking at is the quality of spiritual care in terms of research. And we now have a chaplain who has her PhD as well as a board-certified chaplaincy role, Beth Muehlhausen, who's dedicated to doing spiritual care and research. And so, Stacy, you might talk a little bit about Beth and some of the things that she's doing.
I think that it's given us an opportunity to look at some evidence-based outcomes as to maybe the impact that spiritual care has in patient satisfaction, in just in employee well-being, employee engagement, and things like that. And so there's lots of opportunities. There's so many opportunities to work with different physicians and clinicians, and to start to do even more case studies, do more things to put spiritual care on the map in a way that other clinicians will understand spiritual care. I think that may help build some trust among us as colleagues, right? When we start to speak more of the same language, when we see that research is being attempted, it's always going to be a much harder thing to research outcomes of spiritual care. We have one study going on with Dr. Jenny Chang in the Neal Cancer Center right now, where she's looking at some of her patients that are projected to have about a 6-month life expectancy. And once the physician has been able to document that, to see if they want to be a part of a study that either puts them in a group that is followed by a chaplain and has a weekly visit with a chaplain, or is followed. Another arm of the study is meditation and kind of psychosocial support, and then the other is just the continued care that they would normally get. And Dr. Chang believes that it makes a difference in the life of the patient in those final days, that there's an acceptance of what's happening to them that happens sooner when they're taking this journey with a chaplain, that physically even makes a difference in their blood work and things like that. It's not to say it's going to cure them, but it's going to give them better quality of life, and it's going to maybe even extend life a little bit, because their body has physically, been able to mentally, spiritually, emotionally, physically been able to accept the reality of what's happening to them. And so we look for more opportunities to be able to do that. And with having somebody like Beth here and working in our research institute here, we can find more opportunities to where spiritual care can be a part of other research projects that are going on.
Fantastic. I also think about, spiritual care in terms of quality is really providing love and care to the patient, because it's really not about prescribing medications or implanting devices or removing things, as you mentioned. It's really loving the patients. Tell me a little bit more what you think about that.
I agree. I think that this is when I think that when we have the time, we have the privilege of time to be able to sit with a patient, to be able to sit with a family member, and to be able to listen to the stories that they hold within themselves. Every single person comes to us with stories of their life, stories that we don't want to get lost in the noise of the medical story that's happening within them, around them. And so when somebody has the time to just sit and genuinely listen, to make people feel valued, to make people feel heard, that they matter. We just live in a society that goes so fast right now that those moments where you feel connected to another human being.
Priceless.
Yes. And that's what we have the true privilege to get to do, because we have the time to be able to spend with patients and families like that. And so when we hear those stories and we facilitate process to help them make meaning of their own story, their own life, their own medical journey, whatever that looks like, that I think conveys the love that you were speaking of. It conveys the value of them as a sacred person of worth and as a human.
Yes, and I think that time, we are actually missing that time, because everything becomes more and more efficient. There are processes that become more and more standard. There are things that you, as a care provider, you have to click in the chart, and everything becomes more automated, less personal, less time we spend in every interaction. So this is an opportunity to bring back the time. I love it. Yes, Dr. Millikan.
Well, also spiritual care owns biomedical ethics. I'm the executive sponsor for biomedical ethics for the Houston Methodist system. And I went to Georgetown University for a number of years and got to sit at the feet of some of the greatest bioethicists at the Kennedy Institute the world has to know, Edmund Pellegrino being one, and what we learned. But what we also learned is the role of clinical ethics and how important it is, because when you're in the hospital, you don't have one doctor, you don't have two, you have a lot of doctors. And it's important that they all speak with each other, and we're working at that. But also you need someone who can be able to coordinate with the families, the best plan of care. And to be able to have biomedical ethics, knowing that it's faith-based and that it's part of spiritual care and that it's a part of who we are, means that when you go into the hospital, you not only have the best medical care, but you also have the best counsel. And
so how do you really communicate with patients with different faith, different background, maybe a different understanding of what spirituality is, different beliefs, different habits. How do you as a team extend yourself and get that understanding?
Well, that begins at the very beginning of our clinical pastoral education program. In order to become a chaplain, you have to go through this residency program. And part of it is understanding that there is diversity and that you're a person who's constantly aware that there are different ways of understanding faith and religion and spirituality. And that when you step into the room, you're stepping into that culture of whatever that person is in. So you need to be extremely sensitive as you step into any hospital room, in that you're stepping into another person's world. And so it's important for us to know that if you're a Hindu or a Buddhist or Jewish or a Christian or a Protestant or a Catholic, how to be able to respond in a way that meets best that patient's needs, and to have your antenna up to understand that well before you walk in, and to be able to do your homework before you get in. And so we, of course, pride ourselves in having a very low mortality rate, but from time to time we do lose people in the hospital. And there's certain religious cultures that have a different way of understanding how you take care of death. And it's important for the chaplain to understand that and to respect it and to know it. That's why you're a board certified chaplain and not just a chaplain.
Yeah, and do we have chaplains from all faith, from all backgrounds here at Houston Methodist?
We have a good number. We also have a great relationship with the Galveston Houston Diocese, with the Catholic Church, with the cardinal there, but also with our Jewish community. Also, with our other persons of the Muslim community. We have actually Muslim chaplains who are a part of our system. I'd like to speak to that, Stacy. I know you've done a lot of work with that.
We do. Most of our chaplains across the system come from some sort of Christian tradition. But we have our first humanist chaplain that has been, again, board certified and has been endorsed by a humanist society, humanist organization. I think we have 4 Muslim chaplains throughout our system that are at some of our different hospitals. And we are consistently trying to reach into some of the different faith communities, the Jewish community, the Hindu community, to engage them into that clinical pastoral education program that we were talking about. That's kind of where the recruiting process begins, is to reach into those faith traditions and help them understand what a ministry, a career would look like in a hospital setting, get them that year-long training, and then hopefully move them into this hospital space. So there is some on our part that needs to do some recruiting to get people into our pipeline, into our system, to be able to serve with us on staff. But when we don't have that faith tradition represented by a paid employee here, then that's where our relationship with the community religious leaders is very important. And we do a lot of things to make sure that we keep those relationships nurtured and going, so that the minute we have a patient that has a need that we cannot meet because of a particular faith tradition, it's a phone call away to have somebody come into the hospital to meet that spiritual need.
This is wonderful. I'm going to end with a question that I ask all my guests in this podcast, and I'll give you an opportunity to answer one at a time. Maybe Dr. Millikan, you'll go first. The question is, what does quality mean to you?
Quality means caring for the whole patient, understanding carefully what it is they're struggling with as they come into our hospital system. I know that they're here for a reason. There has to be something going on that is a concern for them physically. But it's important to also understand that quality means that we understand that it's not just the disease they're working with. We're working with people who have a disease. They're not the disease. They're a person with a disease or with an issue. And so to be able to have the person understand that they are loved and cared for as persons of sacred worth is quality in me.
Wonderful. Stacy?
That's very similar to what I would say. That for me, in a healthcare setting, when we're thinking about quality of care for our patients, it is caring for the whole person. It's not separating out. And it's not also thinking that only certain people have certain roles. I think that quality means educating our physicians, educating nurses on what spirituality is, and being able to care for the whole person, to be able to identify spiritual distress. And then, yes, bring a professional chaplain in to spend the time to do the work with the patient, but to have a culture of clinicians that understand spirituality, understand how important it is to the holistic care of a human being, and then being able to work alongside of each other to support a patient. That to me is quality.
I love your answers, and it just dawns on me that they're so different than the definitions that I heard before, because a lot of times when I interview clinicians and quality leaders, the quality is about, the numbers of the populations. For example, less complications as a whole, less mortality as a whole. And these metrics and numbers are certainly important, but what you both bring is something that is just the opposite or the complementary of that, which is we're going to focus on the individual. We're going to pause. We're going to give time. We're going to love, because love doesn't come with metrics. It comes with attention and time and really caring. So thank you so much for being my guests today. I very much appreciate the opportunity to speak with you both.
And thank you for your leadership and what you're bringing to Houston Methodist. We're reaching new heights because of you.
Thank you.
Absolutely. Thank you.
Thank you. And thank you for listening. Quality Time is part of Houston Methodist Leading Medicine series of physician-led podcasts. So that you never miss an episode, subscribe to Quality Time. New episodes will download to your podcast device. If you enjoyed our conversation today, please consider rating this episode and sharing it with your colleagues. I appreciate your support. Thank you. And until next time, I am always listening.